Hello, everyone. My name is Kirk Montgomery, and I'm honored to serve as the president of the State Employees Association of North Carolina. I appreciate the opportunity to address the board and Treasurer Dale Falwell to discuss the critical future of the state health plan. As you know, SEANC is the largest organization dedicated to protect the benefits of the state employees and retirees. The state health plan, along with the retirement system, is a cornerstone of these benefits, crucial to supporting our members in the service of North Carolina. Given the current fiscal challenges of the plan, it is easy that we might have an inclination to consider cost sharing of this plan and passing this over to our members. I'm here to explain why this is not a sustainable or is it viable for us to do. The reality is stark. State employees and retirees simply cannot afford additional costs for decades of pay increases that have failed to keep up with inflation. In the past 10 years alone, state employees' pay raises lag behind 12% behind the broader labor market. Retirees have not seen a frequently ongoing COLA in many, many years. The current economic situation leaves state employees and retirees struggling with the rising cost of living while the benefit continues to shrink. The state and taxpayers cannot afford to transfer more financial responsibility to the plan's members. Doing so, may provide temporary financial relief to the plan, but it will keep an ongoing crisis that is exacerbating every day. More employees will be driven out of state service, and prospective hires will think twice before even becoming a state employee. The vacancy crisis, which has plagued our agencies for years, affects every North Carolinian. Today, we are able to meet about 75% of taxpayers' demand, basically by the essential need that we have a 25% vacancy rate, and it's getting worse. Consider our prison system. Some facilities have a 60% vacancy rate. Dangerous working conditions, inadequate pay, and declining benefits make these jobs difficult to fill. And this isn't isolated just to corrections. We have similar challenges in state government from elevator inspectors and DHHS facility staff and teachers. There was once a time when state employees had dedicated employees because the benefits offset the lower wages, but we no longer have that. We are no longer offering health care coverage to retirees. That's an issue that we need to think about and address as well. We do not have a premium-free health plan. It's a wonder people are choosing private sector jobs with better pay and benefits over state jobs. Just to elaborate a little bit more, natural disasters like the recent flooding from Hurricane Helene have only intensified this crisis. The Department of Adult Correction had to transport over 2,200 offenders from 6 flooded prison facilities. And they were already experiencing staff shortages of 30 to 50%. The strain on our correctional workforce has reached a breaking point. Many of the state employees are dealing with the loss of their homes and loved ones, but yet they are asked to actually move and work at another facility away from their homes, from their locations. We also see impacts on DHH facilities like in Black Mountain and with the Department of Transportation, where thousands of miles of dangerous and damaged roads have to be repaired. Staff in these agencies have been stretched thin by years of privatization and mounting vacancies, making the recovery effort even more challenging. I want to express our gratitude to Treasurer Falwell and the state health plan staff for their efforts to keep the premiums at a stable rate. Unfortunately, as a result of stagnant wages and rising costs, members are in a more difficult position than they were from the beginning of this process. The need to keep premiums affordable as more severe than it has ever been. So I ask the board and the legislation to consider solutions that address the funding needs of the state health plan without placing additional burdens on those who cannot afford it. Passing the cost to our members will only worsen the worker shortage, endangers the delivery of critical services, prevent members from getting necessary medical care, and further undermine the morale of employees who already go beyond every day. Employees are an easy place to find the money. We don't want them just to be a standard line item. We want people to understand that these are employees who have dedicated their lives to be state employees and who are focused to work for the public. But to be completely honest, there are obvious ways for the state plan to cut costs without raising or getting an extra dime from state employees. As we say for more than a decade, we need transparency in the state health plan costs. No one knows how much the plan is paying because they're protected. There is no transparency in how we know as far as getting the information that we need to know what we're paying for. How in the world can we achieve efficiency in the plan without knowing what we are paying for to these providers? You know, it's kind of laughable from a sense of that we are paying billions of dollars to providers, but we have no way of knowing what we are paying and how we are paying those prices. The public is literally prohibited by law knowing what they pay for with something that is costing billions of dollars. It's a taxpayer issue as well as an issue for members of the plan who are also taxpayers themselves. Treasurer Falwell tried to unravel this, and he fought both lobbyists and politicians alike. But it's incredibly backwards to where the treasurer of our great state was trying to get prices to be transparent, and there was no way that he could do that because the law had prohibited. I'm sorry, I'm getting a little emotional because this is really something that's deep to my heart because I see what state employees are going through. I've been a state employee for 25, 26 years. And to see the increased cost that we have to have burden upon us is something that, that I don't quite understand. I understand that things have to be done in a timely manner and a budget must be set. But we have to understand that we have people who have dedicated their lives to the state so that they can provide a service, but yet everything that they do, there's an additional cost that's coming to them. All of this leads here, it's a more reprehensive way to think about the plan to employees who are already struggling for more money. If you had all the contracts available to you that you could review and disclose the information that's in those contracts, it would be a different scenario. Because then you would have a viable way and state employees will understand if it showed them exactly what is being paid for. They will have a better understanding of why the plan would have to have an adjustment for them to have to pay. But at this time, the secrecies of these contracts means that the board must seek alternatives. That is not another unaccounted dime should be paid by state employees. State employees should not have to pay an additional dime because they are already struggling. I know it's very difficult for me to speak out and to discuss this, but this is an option that we have to really understand that state employees do not make what the private sector make. They are here to provide a service. They are pushing forward to show the people of the state that they're dedicated. But putting on another burden on them by increasing the cost of their medical expense is something that we really need to understand. We need to look at all alternatives that we can to ensure that state employees are covered and that they have a way to afford living in this state and also provide for their families. I would like to thank the board for your time and for your understanding in this matter. And I would also once again like to thank the current treasurer and his staff for everything, for working with us to ensure that the state employees of North Carolina have a health care system and a retirement system that will supply them for many years to come. Thank you.